Obamacare back in the headlines after the administration announced a decision to delay requirements for some businesses to provide health care to their employees or face fines. And that's raising more questions about other parts of the law, including the future of the individual mandate. We're back now with the panel. Another jump ball. So is this the beginning of the end for the Affordable Care Act? Actually, Congressman, why don't you take it?
Well, we have to focus on what the insurance companies are doing. Insurance companies have had a 16.1% return on their investment or equity. Insurance companies are raising their premiums, so they are helping to transform the Affordable Care Act to the Unaffordable Care Act.
Let's mark down the date and time of a Democrat calling it the Unaffordable Care Act.
Well, you know, it had some good things, pre-existing conditions. We know about that, getting children under 26 on their parents' policies. There's things that are good there, but ultimately the inherent flaw is this is a system, a for-profit system run by the insurance companies. The government is ending up subsidizing insurance companies, and ultimately we're going to have to go to Medicare for all, which would be good for businesses and good for everyone because the cost would be lower and we wouldn't be cutting into jobs and working hours and other things.
Single payer, which is what President Obama said really wanted in the first place.
He was
originally, way back.
Yeah, I mean, he was never for that.
But I think, you know, I think this does at least open the way. It's not the end of the Affordable Care Act, but it does open the door to changes in things like the business mandate, which the pushing it back was responding to a revolt by businesses, particularly in agriculture, in retail, and in restaurant business, where they rely on a lot of part-time employees, and they were holding down employment, and they were holding down the number of full-time employees, and so I think it was a revolt to that. But you even saw Senator Corker this morning saying, let's take a look at it and possibly change it.
Yeah.
There's
well,
word
do you think there's going to be a move afoot to repeal this mandate, the employer mandate? And then if you do that, how does the rest of it work?
I think there's a good chance, John, that the employer mandate never takes effect. That they put it off.
How do you implement the rest of it?
Well, you could implement the rest of it. The problem here is we're dealing with two laws. We're doing the health care law and the law of unintended consequences. And the unintended consequences abound here. Nina just mentioned one of the important ones is that, you know, businesses are changing their hiring practices to try to avoid having enough employees to be under the mandate. So you're getting part-time work, an explosion in the hiring of part-time workers. Well, this is certainly not what the administration intended, or the Democrats in Congress who rammed the bill through intended. So this is a situation where the law as written probably can't work.
Right.
And we're seeing pieces of it sort of fall away or be postponed or whatever. So, you know, some legislative changes in effect, or I think the whole thing may simply collapse.
Another potential unintended consequence is if you implement the individual mandate without implementing the employer mandate, you may have a lot of employers in the year 2014 say, oh, I don't need to be providing health care for my employees. They can get it individually in these exchanges, and a whole bunch of people get dumped off the health care rolls at businesses.
Well, that's possible, but again, let's put away the alarmist tones for just a second and realize that I think it's like 90+% of American employers offer health insurance to their employees. And if you look at Americans as individuals, 80+% get insurance from their employers. So when you're talking about this, you're talking about a small segment. And really what's important here is the individual mandate for young people. You know, the whole thing about should the NFL and the NBA help these young guys understand it's in their interest to have insurance, and of course Republican opposition to that. And I think the defeat this week is the administration making this announcement, trying to sneak it under the wire just before the 4th of July so no one would notice. Everybody noticed, but especially Republicans who are already planning ads, you know, saying this thing is a debacle. This is going to go, you know, against the world and is going to just sink the United States economy. I mean, it just seems to me to be more of Republicans who don't want it to work, who don't have an alternative vision, and who are invested. I mean, as you said, repeal. 37 times the Republican
House tried to repeal the whole thing.
I mean,
and there's a question, and Dennis raised this yesterday in the call, as to whether or not, because this is a revenue issue, whether it belongs in the House as opposed to in the Treasury Department. And if it gets into the House and goes to some sort of vote or legislative process, could they repeal it?
No way, Jose. It just ain't happening. Not with a Democratic majority in the Senate and a Democrat in the White House for whom this is his signature legislation.
We should also mention the other thing that's happening, and there's more news on this week, is the costs of individual policies skyrocketing in the next, for healthy people, skyrocketing as you bring more sick people in. So there's this other source of fear that's being generated among the public right now, and that's just outside analysis. That's not Republicans.
No. The Wall Street Journal did a piece this week in which it said that a healthy man, I think it was age 40, who's a non-smoker, is going to have to pay more if he's trying to get individual insurance.
Yeah.
Now, of course, again, that's a very small segment of the American population.
But is it fundamentally fair to tell employers you've got a year delay to get this together, but individuals, your go point is January 14th? Should the individual mandate be delayed as well?
Well, meanwhile, we started off talking about businesses and the effect on it. Businesses, small businesses in particular, have seen their policies and will continue to see insurance policy increases. That's number one. So number two is all insurance policies are going to go up. This is reform within the context of a for-profit system. The insurance companies are gaming this. They're walking off with the bank, while the consumers are getting it in the neck.
30 seconds.
The problem is that what we're going to do is we're going to say that people who are already sick and don't have insurance can buy it then. Now, that system, which has to do with the pre-existing conditions, is going to drive up the cost for everybody. And there's no way around that, and that would be true whether it was a government system or whether it was private insurance companies administering it. That's what's the cost driver.
We've got to leave it there, but there's lots more to talk about. We'll see you next week on the air.